Hi guys, welcome to episode 2 of Catherine's Anatomy and Physiology podcast. Today I'm here with
Ashley.
And we will be doing an oral motor exam. So an oral motor exam, as defined in Differding's Articulation, Resonance, and Swallowing lecture, is an exam performed by an SLP that evaluates the oral motor skills, meaning the muscular movement of the face, such as the lips and the jaw, and the oral area, such as the tongue and the velum, or the soft palate. The three main areas that we'll look at through our observation, we'll do an observation of the anatomy, we will look at the examination of speech characteristics, and then we will do a diodokinetic assessment at the end to assess the coordination of the speech sounds. So, as you remember, we went over a few subsystems in the last video, and these subsystems can relate to an oral motor exam, Neurology may appear as a deficit in sensation, which is one of the areas that's assessed during an oral motor exam. Phonology, you may be able to discover a structural abnormality during this assessment. For respiration, you might find that someone becomes winded when you're assessing the prolonged phonation with the velum. And resonance, articulation, and swallowing are really the main point of this exam. You're able to see how the different articulators interact with one another. You can see how the sounds resonate in the different cavities. And swallowing, you can kind of get a feel if there's moisture or something stuck in the throat as well. So I'm going to start off by getting a brief case history of Ashley. Could you please state your age and your gender?
I'm 19 and a female.
Thank you. And do you have any medical history that may contribute to articulation or swallowing problems, such as an oral or dental surgery?
I've had my wisdom teeth taken out.
Thank you. Have you ever had speech therapy before?
Yes.
What for?
I had a lisp.
Thank you. Do you have any complaints at this time about your speech or swallowing?
No.
Okay. I would describe Ashley's speech as fluent. She's able to articulate her words and express emotion while she's speaking. She does not appear to struggle with cerebration, and she's able to comfortably engage in conversation. Okay, so now we're going to get into the oral motor exam. So the areas of an oral motor exam are strength, symmetry, range of motion, and sensation. For the sake of this video, we're just going to assess strength, symmetry, and range of motion, and we are going to do so for the mandible, the jaw, the lips, the tongue, and the velum, or the soft palate. So I'm going to go through, describe what I'll be doing, and then performing it on Ashley. So we're going to start off with the mandible, or the jaw, and we're going to start off with strength. Is it okay if I touch your face?
Yes.
Okay. To assess the strength of her jaw, I'm going to ask Ashley to keep her mouth closed, and I'm going to try and pull her jaw down. I want you to try and not let me open your mouth, okay? Perfect. And I could feel Ashley's jaw staying in place against the force I was trying to pull it down with. The next part of strength, I'm going to ask you to, again, have your jaw closed, and I want you to try and open your mouth while I push up against it. Ready?
Mm-hmm.
Perfect. Again, I could feel the strength of Ashley's jaw pushing my fingers down, even against the force of my hand pushing against it. Okay, for symmetry, I'm going to ask her to move her jaw left and right like this,
Okay.
just to see how it can shift and if it can do so equally on both sides.
Okay.
Thank you. And for range of motion, I'm going to ask you to open, close, left, right, so I can see how it shifts going up, down, left, right.
Okay.
Perfect. Thank you. And again, you could see that with both the symmetry and the range of motion, she was able to move her jaw in various directions equally on both sides without looking like there was too much of a struggle or deficit. The motor nerve of intervention for the mandible and the sensory area too is cranial nerve 5, the trigeminal. Okay, next we're going to do the lips. So starting off with strength, I'm going to ask you to purse your lips, so sort of a fake smile, and I'm going to try and pry your lips open with my fingers.
Okay.
Ready?
Mm-hmm.
Perfect. So I could feel Ashley's lips staying together. Even as I tried to pull them apart, I could feel the muscles contracting and her lips were able to stay together. For symmetry, I'm just going to ask you to smile. Perfect. As you can see, she's able to elevate both sides of her lips and her smile looked very even. Next up, for range of motion, I'm going to ask you to alternate from a pucker or duck lips to a smile. Just go back and forth a few times. Perfect. As you can see, Ashley is able to go from the pucker to the smile and the smile to the pucker. This allows us to see not just alternating to one movement, such as the pucker, but how she can go back and forth for range of motion. And the lips are innervated for motor by cranial nerve 7, the facial, and for senses, it's cranial nerve 5, the trigeminal again. Okay, next up we're going to do the tongue, and for this part I'll be using a tongue depressor and a flashlight. Starting off with the strength, what I'm going to do is I have a tongue depressor with me. I'm going to try and go in Ashley's mouth just a little bit and push the tongue depressor against either side and the tip of her tongue, and I'm going to ask that you try to resist the force of the tongue depressor.
Okay.
We will start with your left, so perfect, right? Perfect, and now tip. There you go. So as you can see, even with the tongue depressor pushing against her tongue, I really wasn't able to push it that far because she was able to use the muscles in her tongue to resist the force. For symmetry, I'm just going to ask you to stick your tongue out, like, as you can see, it comes out immediately. It doesn't fall to one side or the other, so the symmetry looks good. For range of motion, I'm just going to ask you to go up and down and side to side, kind of similar to what we did with the jaw.
All right.
Perfect. As you can see, again, she's able to move the tongue up and down, side to side in a few rotations, which indicates that her range of motion is good. All right, the last one we're going to look at is the velum. So for the velum, you can assess strength and symmetry the same way by doing a prolonged ah. This is because doing the ah will cause the velum to go up, and if there is strength, it will be able to stay up, and if there is symmetry, I will be able to see it up on both sides. So again, I'll be using a tongue depressor to get a good look in her mouth and a flashlight as well. Okay. A prolonged ah, please.
Ah.
Perfect. So in her mouth, I could see that the velum was going up. It was up on both sides, and she was able to hold that ah without seeming fatigued. For range of motion for the velum, we're going to alternate by doing an ah, 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 initiating and terminating that phonation just to see if she can go back and forth. So again, tongue depressor, flashlight. Ready?
Mm-hmm. Ah, 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 ah.
Perfect. So I was able to see the velum in her mouth going up and down, up and down. She did not seem to be fatigued when she was doing so, and it looked good. The motor nerve intervention is cranial nerve 10 for the velum. The vagus and the sensory is cranial nerve 5, trigeminal. I think I forgot to mention the tongue. The motor is cranial nerve 10, the vagus nerve, and the sensory is cranial nerve 5, the trigeminal. So that concludes the assessment of the range of motion, strength, and symmetry. We're now going to move on to the diodokinetic assessment, which is going to assess how she can do certain sounds in the front of the mouth, like pa, 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 those bilabial sounds, ta, 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 sounds that articulate with the teeth and the tongue in the alveolar ridge, and ka, 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 sounds that are articulating with the soft palate and the tongue. So first I'm going to have her do these sounds individually, and then I'm going to do a sequential assessment, and I'm going to have her put all the sounds together and see how she alternates through all of them. So what we're going to do is we're going to have just a 5-minute timer. I'm going to set it on my phone, And while you're doing it, I'm going to ask you to try and say pa 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 as many times as you can and as fast as you can, okay?
Yep.
All right. Are you ready?
Yep.
Okay, go. Perfect. Okay. And the norm is to be able to get 15 repetitions in 5 seconds, and I counted over 15 in that 5 seconds, so the pa sounds good. All right, next we're going to do ta-ta-ta-ta-ta, which is the tongue, back of the teeth. Same thing, 5 seconds, just as many times as you can. Ready? Go. Perfect. Okay. Again, able to get 15 repetitions in there. The last one we're going to do for the isolated sounds is ka 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 ka. So again, same thing, 5 seconds. Are you ready?
Yep.
Okay, perfect. All right. Again, I was able to count 15. The ka sounded to be a little bit slower, but it was still there. So next we're going to do a sequential assessment. So we're going to put those pa, ta, ka sounds together. What I'm going to ask, again, just going to be 5 seconds. I want you to say pa, ta, ka as fast as you can, or you can say buttercup, okay?
All right.
You ready?
Yeah.
Go.
Buttercup, 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 buttercup,
Got it.
buttercup.
Okay, thank you. She was able to get the repetitions in. There was a little bit of blending of some of those sounds, but it was still done. Okay, so now that we've finished the Diodokinetic assessment and the oral motor exam, that concludes our video. These were able to look at different areas of her articulation and resonance, and thank you for joining me today, Ashley.
Thank you.